It is late at night. Your dog is lying beside the couch, and then you hear it again. Scratch, scratch, scratch. A few minutes later, they are licking one paw, rubbing an ear against the carpet, or chewing near the base of the tail. You may think, maybe I just need a better shampoo, a stronger spray, or one more allergy product. But before you buy another bottle, there is something more useful to check: the pattern. Because scratching is not one simple problem. It is your dog's way of telling you that something feels wrong on or under the skin. Sometimes the cause is small and easy to fix. Sometimes it needs a veterinarian's help. And the product that helped your neighbor's dog may do nothing for yours, because their itch may be coming from a completely different place. Today, let's slow down and become a calm detective for a few minutes. You will learn what to look for, what you can safely check at home, what many owners miss, and when scratching is no longer something to watch and wait on. This is not a way to diagnose your dog online. It is a way to notice useful clues, protect your dog's skin, and give your vet a clearer picture if you need help. The first thing to understand is that scratching does not always look like scratching. Some dogs do the obvious thing. They sit down and rake a back foot across the same spot over and over. But other dogs lick their paws until the fur turns damp and rusty brown. Some rub their face on the floor. Some shake their heads. Some scoot their rear end. Some suddenly cannot stop nibbling at their hips. And some act a little grumpy when you touch an itchy place. That matters because the location can be a clue. A dog that keeps chewing the paws may be dealing with one set of triggers. A dog that is frantic around the tail base may point you toward another. A dog with repeated ear scratching may need the ears looked at, not just the coat. You do not need to solve the mystery from one clue. You simply need to stop treating every itch as the same itch. So before you open a shopping app, ask one easy question: where does your dog start? Not, where do they scratch once in a while? Every dog scratches sometimes. Think about the place they return to. Is it the ears, the paws, the belly, the armpits, the rump, the neck under the collar, the lower back near the tail? For the next few days, make a tiny note on your phone when you see it. You do not need a fancy chart. Just write the time, the body area, what happened before it, and what the skin looked like. For example, after evening walk, licked front paws for 10 minutes. Or, after lying in the new bed, rubbed face and ears. Or, scratched rump after coming in from the yard. That simple note can tell you more than a random product review ever will. Here is why. Itching often has a rhythm. Maybe it gets worse after grass time. Maybe it happens most after baths. Maybe it is only at night when your dog settles into one room. Maybe it started a few days after a new grooming visit. Maybe it comes and goes during certain months. Maybe it happens no matter what, even on quiet days. Patterns do not prove the cause, but they can keep you from guessing blindly. Now let's talk about the first big thing to check: parasites. Many people look for one flea jumping across the fur, do not see it, and decide fleas cannot be part of the problem. But fleas are easy to miss. They are quick. Your dog may groom them away, and some dogs can become very itchy from only a small number of bites, especially if they react strongly to flea saliva. That is why "I never saw a flea" is not always the same as "fleas are definitely not involved." Take a quiet moment in good light. Part the hair around the lower back, the base of the tail, the belly, and behind the ears. Look for tiny dark specks, little scabs, irritated skin, or areas where your dog seems bothered when you touch gently. A fine flea comb can help you collect anything sitting close to the skin. If you see dark crumbs, place them on a wet white paper towel. Flea dirt can leave a reddish-brown smear when it gets wet because it contains digested blood. But do not panic if you are unsure what you see. A veterinarian can help tell the difference. The important part is not to start stacking random flea products or using an old treatment without checking the label, your dog's age and weight, or your veterinarian's advice. Never use a product made for another animal or another species. And do not assume that one treatment on one dog fixes the whole situation. If parasites are suspected, your vet can guide you on a safe, complete plan for your dog and household. But parasites are only one possibility, and this is where many owners get stuck. They find no flea, so they jump straight to food. Then they buy a new food, 3 supplements, a skin powder, a shampoo, and a bag of treats labeled sensitive. A month later, the dog is still scratching, the owner is frustrated, and nobody knows what changed the pattern. Food can be part of an itch problem for some dogs, but it is not the only answer, and it is not always the first answer. Environmental triggers, skin infections, ear problems, parasites, moisture, contact irritation, and other conditions can all look similar from your living room. That is why a fast food swap can sometimes make the picture more confusing instead of clearer. Think of it this way. Your dog's skin is like the outside wall of a house. When the wall is calm and healthy, it helps keep irritating things out. When it is already inflamed, scratched, wet, or infected, even small things can bother it more. Your dog scratches. The skin gets more damaged. Then the damaged skin itches more. It can become a loop. This is one reason a product may seem to work for 2 days and then stop. It may quiet the surface feeling without changing the thing that started the loop. Or it may help one dog because that dog had dry skin, while your dog has an ear issue, fleas, or a skin infection. The goal is not to find the most popular product. The goal is to understand what problem you are actually trying to solve. So after you check where the itch happens, look closely at what the skin is saying. You are not looking for a perfect medical answer. You are looking for changes. Is the skin red? Is it flaky? Does it have bumps? Does it look greasy? Are there little crusts or scabs? Is there hair missing? Is one patch wet, hot, painful, or smelly? Do the paws look red between the toes? Does one ear smell stronger than usual? Is your dog shaking their head, tilting it, or pulling away when you touch near the ear? Those details matter. A dog with an itchy ear may not be just itchy. An ear that is sore, smelly, red, or producing discharge needs a veterinary look. The same is true for a skin patch that is wet, painful, bleeding, spreading, or has a strong odor. Dogs can make small skin problems worse very fast when they lick and chew the same spot. What began as a little irritation can turn into a raw sore. And this is where it is tempting to reach for home remedies. Please be careful. Do not put human creams, human pain medicines, peroxide, alcohol, essential oils, vinegar mixtures, or mystery online treatments on your dog's skin. Something that seems gentle to us can irritate a dog's skin, be unsafe if licked, or hide a problem that needs treatment. You are not failing your dog by skipping the kitchen cabinet fix. You are protecting them by not adding another unknown. Now here is the thing most owners miss. The itchy spot is not always where the problem began. Your dog may lick the paws because walking through damp grass irritates the feet, or because the skin between the toes is already uncomfortable. They may rub the face because the ears are sore. They may chew at the hind end because of flea bites, an irritated skin patch, or another issue that needs an exam. The behavior is a message, not always a map. That is why a where, when, and what changed check is so powerful. Start with where. We already covered that. Next is when. Does the itching happen after walks, after naps, during the night, after eating, after baths, after being in one room, during certain weather, right after grooming? Those timing details can be surprisingly useful. Then ask, What changed? Think small. New laundry detergent on dog blankets, a new floor cleaner, a scented candle near the bed, a new shampoo, conditioner, grooming spray, collar, harness, bed, rug, or toy. A move, a new pet, a new park, longer grass in the yard, more rain and mud, a change in how often your dog is bathed. Even a warmer, more humid week can make damp skin and paws harder to manage. Do not assume every change is the cause. Life would be much easier if it worked that way, but write it down. This gives you a short list to discuss with your vet instead of trying 20 things at once. One more gentle check is the places where moisture and rubbing get trapped. Look under a collar or harness, between the toes, in skin folds, and under a thick coat after rain or a bath. Dampness does not explain every itch, but it can make irritated skin feel worse. After wet walks or bathing, use a clean towel to dry your dog well. And watch their reaction when you touch the itchy area. Flinching, yelping, snapping, or pulling away can be a pain clue, not bad behavior. That is a reason to stop experimenting at home and ask your veterinarian for help. Now, let's talk about the product trap. When you feel worried, buying something feels like doing something, and sometimes a vet-recommended product truly is part of the solution. But buying 5 products at once can make things harder. A new shampoo may irritate. A scented spray may add another trigger. A supplement may upset the stomach. A food change may make it impossible to tell what is helping. And if your dog is on prescribed medicine or a prescription diet, adding things without checking can complicate their care. Instead, make your first purchase a notebook page or a note on your phone. Record what you already use: the flea prevention, shampoo, treats, food, chews, grooming products, and cleaning products around your dog. Include when you started each one. Take clear photos of the skin on the day you notice a flare. Then, take another photo a day or 2 later if it changes. Skin is hard to describe from memory. A photo can help a veterinarian see whether it is spreading, drying, getting darker, losing hair, or becoming more red. And do not forget the ears. Ear problems and skin problems often travel together. You may notice your dog scratching their ear, shaking their head, rubbing one side of the face, or suddenly hating ear cleaning. The ear may smell yeasty, look red, or have unusual wax or discharge. Do not push cotton swabs deep into the ear canal. Do not pour in homemade liquids. If you are seeing those signs, call your vet. Ear pain is miserable, and the right treatment depends on what is actually going on inside. Another useful clue is how the itching began. Did it appear suddenly over 1 or 2 days? A sudden change can make you think about a parasite bite, contact with something irritating, a skin injury, an ear problem, or another issue that needs prompt attention. Did it begin slowly and return in the same season? That may give your vet a different clue. Did it start after boarding, daycare, grooming, a hike, or meeting new dogs? Mention that. Did it start after a diet change? Mention that too. There is no bad detail. The odd little detail you almost leave out may be the one that matters. You may be wondering, so what can I safely do today? First, prevent extra damage. Try not to let your dog chew a sore area non-stop. If they are creating a raw patch, call your vet for guidance. They may recommend a safe barrier or a protective collar based on the location and your dog's needs. Do not tightly wrap a paw or cover skin with something that traps moisture unless a veterinary professional tells you to do it. Second, keep the environment simple. Wash bedding with a mild, fragrance-free detergent if you think scented products might be bothering your dog. Vacuum areas where your dog rests, especially if flea control is part of the conversation. Keep the sleeping area dry and clean. Rinse off obvious mud after outdoor time and dry well. These are not cures. They are gentle ways to reduce extra irritation while you watch the pattern. Third, Avoid adding a dozen new things. Choose calm observation over product panic. That may sound less exciting, but it can save you money, save your dog's skin from more irritation, and give your vet better information. Fourth, make sure your dog's parasite prevention plan is current and appropriate for them. Do not guess based on a neighbor's dog or a social media comment. Your vet knows the products available in your area, your dog's health history, and what is safe for their age and body size. Now let's be clear about when it is time to call the vet. Make an appointment soon if the scratching keeps coming back, is getting worse, wakes your dog from rest, causes hair loss, leads to sores, changes the skin color, or comes with ear odor, ear discharge, head shaking, or repeated paw chewing. Call if your dog seems uncomfortable, restless, less playful, or unusually reactive when touched. Call if you have tried simple, safe steps and you are still seeing the same pattern. You do not need to wait until the skin looks terrible. Early help can prevent a smaller problem from becoming a much bigger, more painful one. Some signs are more urgent. Seek veterinary care promptly if your dog has swelling of the face, lips, or eyes, trouble breathing, collapse, severe weakness, repeated vomiting, severe pain, widespread hives, bleeding or rapidly spreading wounds, or signs of a serious allergic reaction. Also, seek urgent help if your dog has intense scratching along with sudden illness, a major behavior change, or you suspect they were exposed to something harmful. In those moments, do not spend the evening testing products. Get professional help. And remember, your veterinarian is not just going to say, buy a shampoo. A good exam can look for parasites, skin infection, ear disease, patterns that suggest allergies, and other causes that cannot be confirmed from a photo. They may ask about your dog's food, seasonal patterns, current prevention, grooming routine, and every product that touches your dog. That is why your notes are useful. You are not expected to know the answer. You are helping bring the clues. Sometimes the answer is simple. Maybe the parasite plan needs adjusting. Maybe there is an ear infection. Maybe a product is irritating the skin. Maybe the coat is staying damp. Sometimes it takes more than one step, especially with recurring allergy-type itch. That does not mean you have failed. It means your dog's skin needs a careful plan rather than another random bottle. There is one more emotional piece that is worth saying out loud. It is easy to feel guilty when your dog keeps scratching. You may think, how did I miss this? But dogs are good at carrying on while uncomfortable, and many skin problems begin with signs that look small. One paw lick, one head shake, one patch of dandruff, one restless night. What matters is what you do after you notice. You are here, paying attention. That is a good start. So the next time you hear that scratch, 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 do not rush straight to a new product. First, look for the pattern. Where is your dog focused? When does it happen? What changed? What does the skin, coat, ears, and paws look like? Is your dog comfortable, or are they trying to tell you something more urgent? That little detective step can change the whole conversation. It can help you avoid wasted money. It can keep you from mixing too many products. And it can help your veterinarian get to the right next step faster. The biggest takeaway is simple. Scratching is a signal, not a diagnosis. Check the pattern before you buy another product. Watch the body area. Look for skin and ear changes. Think about parasites and recent changes. Keep things gentle. And call your vet when the signs keep going, get worse, or look painful. You know your dog's normal better than anyone. Trust yourself when something feels different. Calm observation and early help can make a real difference in your dog's comfort. Where does your dog scratch or lick the most? The paws, ears, belly, or near the tail? Tell us in the comments.